Madam President, there's a persistent and recurrent narrative that we lived in an idyllic state of health care coverage and health care delivery in Minnesota 10 years ago before the Affordable Care Act arrived. And let me tell you from very personal experience that is an absolute falsehood. I cared for patients for the last 20 years in various settings, but most recently at a safety net hospital in Minneapolis, Madam President. And I can tell you that I can tell you about one patient who came into Hennepin County Medical Center, a young man who was working as a waiter, had no health coverage whatsoever 10 years ago, and he had cut his hand at work. Like most young people, he waited around and thought it would get better, did not want to incur costs for a simple cut by coming into the hospital. He left it to fester for several days. Hand injuries and infections are especially dangerous because of the many planes of tissue, and they can spread rapidly, as you know. And this gentleman, 21-year-old gentleman with no health insurance coverage, finally presented to me, Madam President, with clinical sepsis and required intravenous antibiotics and fluids and several days of hospital care. We were fortunate to save his hand. That was what health care looked like in my world before the Affordable Care Act, Madam President. To narrate that health care was fully covered and idyllic in Minnesota 10 years ago before the government intervened and destroyed it is a false narrative.